Dr Sanjay Gupta, cardiologist and heart specialist, thank you so much for your time today.
Thank you so much for having me on again.
Now, Matthew Perry's most recent autopsy report, the toxicology report, revealed that he died of acute effects of ketamine. Can you explain to me in layman's terms what that means?
Yeah, first of all, I mean, this is all very sad, and my sincerest condolences to Matthew's friends and family for this horrible tragedy. Ketamine is used by medical practitioners and vets as an anesthetic. At lower doses, it can provide with relief from pain and depression, and it can also be used illegally by people to get high. It's a dissociative drug, which means it causes people to feel separated and detached from their body and physical environment. And in that sense, the dissociatives are similar to psychedelics. They can cause hallucinations, other changes in thoughts, emotions, and consciousness. And ketamine can cause feelings of happiness, relaxation. That's why it's popular as a recreational agent. Feelings of being detached. It can lower sensitivity to pain. But if you take ketamine in very high doses, then it can also be dangerous.
I want to ask you, the report noted that the actor was undergoing ketamine infusion therapy. What does that mean, that kind of therapy?
Yeah, so ketamine at lower doses can be given as an infusion, and it's very good to control pain. It's a controlled way of treating chronic pain and depression, especially when traditional therapies have failed. And as you know, Matthew had an opioid addiction in the past. And because of that, ketamine in some ways is a less addictive option compared to opioids and can provide similar relief in terms of pain. And that's why I think someone like Matthew, who had that long-standing battle that he had been facing with addiction, etc., was probably using this or was being given this.
Mm. Well, in the report, it said that his last infusion therapy was actually the week before his death, and that the drug only stays in someone's system at that kind of height between 3 to 4 hours. When the report says that he had high levels of ketamine found in his blood, does that mean that he was most likely recreationally taking ketamine on top of that infusion therapy?
Yeah, I mean, I think the when I read that report, they talked about some ketamine being found in his gut as well, which suggests that maybe he had taken more orally than perhaps he needed to on the basis of the fact that he was already getting the infusions. But you're right, the other problem, of course, is that it depends on what you take the ketamine with. So if you just take ketamine on its own, it may not be as dangerous or as risky as if you combine it with opioids or alcohol or cocaine or other drugs as well. So it does seem that he probably had taken more ketamine orally.
Dr Gupta, the autopsy also revealed that he had a coronary artery disease that contributed to the death. Can you explain what that might mean?
Yeah, so what we know is ketamine has cardiostimulatory effects. What it means is that it increases the heart rate by about 30%. In the doses that were found in his body, ketamine will increase the heart rate by about 30%. It increases the blood pressure by between 20 to 30%, and it increases the demand, oxygen demand of the myocardium by about 50%. So in general, it's not a good anesthetic when people have significant coronary disease because it's making the heart work harder, it's asking for more blood, and these people, because they have coronary disease, struggle to get the blood where it's needed. So anything that increases the demands when the supply is not adequate is a bad thing. So if he had underlying coronary disease, that makes him much more vulnerable to the risks of ketamine. The cardiostimulatory effects is this thing you don't want to do in people with coronary artery disease. You don't want the heart to work harder. You don't want to create a greater imbalance between supply and demand.
Does that mean it is still safe to say that Matthew Perry died of a heart attack that led to his drowning?
I mean, there are a variety of possibilities on there. There's, of course, the first thing to say is that, ketamine in very high doses can cause delirium. It can cause people to become unconscious. So if he loses consciousness, well, that's a possibility. That could just cause drowning. The second thing to say is, of course, if you've got coronary disease, then it can if you are creating that demand and the supply is not there, then the heart can go into abnormal heart rhythms and they can be very dangerous. So he may have developed a cardiac dysrhythmia as a result of coronary disease. And on top of it, the demands placed upon by increasing the heart rate and the blood pressure like ketamine does. So those are all possibilities. But what we know is that certainly the ketamine would be a contributor, the coronary disease would be a contributor, and perhaps the loss of, the unconsciousness or delirium that can come along with just a lot of ketamine would also have been a contributor.
Dr. Gupta, Matthew Perry aside, what does the use of ketamine do to the heart, and is there any long-term damage?
I mean, I think, a lot of these medications, of course, it depends on how much you take it, whether you take it in controlled quantities, whether it's being supervised, depends on your body weight, etc. But there's no doubt that increases the heart rate, it increases the blood pressure, and most things that increase the heart rate and the blood pressure are not good. If you then combine it with Matthew's mental health issues, etc., all that forms a really bad concoction for the development of heart disease, and generally is very unhealthy for the heart. So yeah, I think I think everyone has to be very careful about agents like this, because sometimes you get started with the right intentions and then you need more and more, and then something bad like this can happen.
And you and I have spoken about the damage that is done after decades of addiction and what that does to the body, even if you are sober for a long-term amount of time. But do you think that the decades of addiction and, abuse with alcohol and drugs played a significant part in his eventual death?
I'm sure they were a contributor. If you take many 50-year-old men and look at their heart arteries, many of them, even though they may not be using agents like this, will have some degree of coronary disease. So, in retrospect, one could say that certainly, the struggles that he had would have contributed. But equally well, there are lots of people who develop heart disease who don't do these things. So unfortunately, it's a case of genetics, genetics, age, and then on top of it, bad lifestyle. And this would also count as bad lifestyle.
Mm. Just finally, Dr. Gupta, ketamine in general has been dubbed Britain's go-to party drug as of late. Why do you think that is?
I think because of the fact that it creates very similar feelings of euphoria and happiness and relaxation, and perhaps it's not got the same kind of risks as some of the other more hardcore drugs. But the reality is, any drug like this, if taken in excess, can be very dangerous. And of course, if you have underlying heart disease anyway, then all these things become a lot more dangerous.
Dr. Sanjay Gupta, thank you so much for your time today.
Thank you so much.